Welcome to this Clinical Explainer. Today, we're investigating a hidden physiological crisis that is unfolding in millions of bedrooms every single night. We're talking about morning dry mouth. Look, for decades, the medical community and the public have kind of just brushed this off as a normal, slightly annoying part of getting older. But let me be entirely clear. It is absolutely not. When you actually analyze the systemic data behind this, it becomes a critical clinical revelation. Right now, this symptom is silently affecting nearly 1 in 3 adults over the age of 60, and for the vast majority of them, it's a glaring red flag of systemic breakdown.
Exactly. As we synthesize the data for this investigation, we realize just how completely misunderstood this symptom really is. We're going to peel back the layers on what this silent dehydration actually means. We're not just looking at a dry tongue here, we're looking at a highly active warning system.
Think about your own mornings. You wake up and your mouth feels like it's packed with cotton. Most of us just roll over, chug a glass of water from the nightstand, and move on. But what if I told you that waking up with that severe dryness is essentially stumbling upon a high-stakes crime scene of physiological shutdown? We need to completely reframe how we look at this. What if that dryness has absolutely nothing to do with thirst? What if instead it's a systemic warning your body has been desperately trying to send you for months or even years, and nobody ever taught you how to read the signals?
Okay, let's dive into this. We've all done it, right? Waking up feeling like you chewed on a sandbox. But the absolute most dangerous thing you can do is fall for the harmless assumption that you simply didn't drink enough water before your head hit the pillow. We really have to shatter that nighttime hydration myth right now. The clinical reality is incredibly stark. After age 60, your body already experiences a natural 30 to 40% baseline drop in saliva production. That alone makes you vulnerable. But when chronic dry mouth sets in, the stakes literally become life or death. We're looking at a massive 45% higher risk of systemic infection. Missing this vital fluid isn't an inconvenience, it's a deadly vulnerability.
You know, this genuinely fascinates me, because we've all been conditioned to think of saliva as basically just water in our mouths. But looking at the clinical breakdown, it's something straight out of a sci-fi defense system. It's a highly sophisticated biological fluid. That's precisely the right way to look at it. Saliva is your body's frontline bioshield. It is packed with specific enzymes, antimicrobial proteins, and defensive compounds. Its entire job is to operate a 24/7 security perimeter for your immune system. When your salivary glands shut down overnight and your mouth dries out, that bioshield completely collapses. You're literally opening the gates and giving bacteria, fungi, and viruses a direct, unimpeded path right into your bloodstream.
Well, this brings us directly to our first major hidden culprit, Section 1, cellular starvation and suffocation.
We have to talk about mouth breathing. Far too often, patients dismiss this as just a bad sleeping habit or a weird quirk. But in the clinical data, it is almost never just a habit. When air constantly rushes over your palate and throat, it rapidly evaporates moisture, destroying that bioshield we just talked about. But more importantly, it's a glaring indicator that you are suffocating your vital organs while you sleep. Mouth breathing is frequently driven by underlying structural issues like sleep apnea. And if you're waking up with a dry mouth because of untreated sleep apnea, you're facing a massive 60% increased risk of stroke and a 40% increased risk of heart failure. If you wake up with a dry mouth, you snore, or you feel unrested, your cardiovascular system is actively under siege. You must ask your doctor for a sleep study immediately.
And look, if you're thinking, I'll just drink a huge glass of water at 10 p.m. to fix the dryness, you are falling into a massive trap. People are 62% more likely to experience severe overnight dry mouth if they have an afternoon hydration deficit. This is cellular starvation. Between noon and 4 p.m., your body is absolutely desperate for fluid to distribute to your tissues. If you wait until right before bed to drink, the window has already closed. It takes hours for fluids to be absorbed and made available to your salivary glands. Drinking at night is simply too late. The moisture goes straight to your bladder, not your cells.
Exactly, which is why the strategy has to shift entirely. You have to front-load your hydration. And here's a critical clinical pro tip for you. Plain water often just isn't enough as we age. By adding a small pinch of sea salt and a squeeze of lemon to your afternoon water, you introduce vital electrolytes. These electrolytes change the osmotic balance, helping your aging cells actually grip and hold on to the fluid you're consuming, rather than letting it pass straight through your system and out into the toilet.
So we're suffocating our cells with bad airflow, and we're starving them of proper daytime fluids. But how does actual food nutrition tie into this morning mystery? It's a fantastic question, because nobody associates a dry mouth with malnutrition. But remember, your salivary glands are highly metabolically active tissues. They require heavy, constant fuel. If you're deficient in vitamin A, the very membranes of your mouth begin thinning and failing. A lack of vitamin B3 or niacin actively disrupts the nervous system signals that tell your mouth to water in the first place. And a vitamin B12 deficiency triggers severe inflammation, turning your tongue smooth and persistently dry. Your glands are literally starving to death for these specific vitamins.
To put a solid number on this nutritional starvation, adults over 60 with low vitamin A levels see an astonishing 41% reduction in resting saliva production. You're operating your biological defenses on a fraction of their normal capacity. And the hidden danger here is the vitamin B12 piece. Because of reduced stomach acid as we age, B12 absorption plummets. Up to 30% of older adults are silently suffering from a B12 deficiency and have absolutely no idea. They just think they're getting older and their mouth is a bit dry, while their cellular machinery is quietly grinding to a complete halt. Now we move to a clinical warning flag that is an absolute emergency. Section 2, the blood sugar alarm.
Now, what's really interesting about this is, if you're waking up with a severely dry mouth, and you are also getting out of bed multiple times a night to urinate, your natural energy balance has crashed. Your kidneys are detecting dangerously high, uncontrolled blood glucose levels, and they are taking drastic, systemic action. The sheer scale of the warning we're ignoring here is staggering. 63% of newly diagnosed type 2 diabetics reported this exact symptom, morning dry mouth, for over a year prior to their official diagnosis. Think about the physiological violence happening here. Your kidneys are frantically pulling water out of your body's tissues to flush out the toxic excess sugar. You are being aggressively dehydrated from the inside out, and your dry mouth is the alarm bell ringing into the void for an entire year. And as if metabolic failure wasn't enough, we really must investigate the ultimate systemic betrayal. Section 3, immune system sabotage.
There is an autoimmune mastermind out there known as Sjogren's syndrome. In this scenario, your body's own immune system literally goes rogue. It stops defending you and mistakenly targets, attacks, and destroys your own moisture-producing glands. It primarily hunts down your salivary glands and your tear glands, shutting off your biological shield by brute force. And what completely disgusts me as we look into this is the diagnostic gap. The average patient suffers for 3 agonizing years from the onset of symptoms before anyone figures out it's Sjogren's. 3 years. Because the medical system is treating this systemic collapse in complete isolation. You go to the dentist for the dry mouth, the eye doctor for the dry eyes, the rheumatologist for the joint pain. No one connects the dots, and your body continues to slowly destroy itself while you're handed temporary, useless band-aids.
This is exactly why you must take control of your clinical reality. If you're listening to this explainer and experiencing these symptoms, particularly if you are a woman over 60, who by the way make up nearly 90% of all Sjogren's cases, you have to stop waiting for a doctor to offer you the right tests. You need to walk into your next appointment and explicitly demand the anti-SSA and anti-SSB blood tests. These are the specific markers that reveal the autoimmune sabotage. Do not wait 3 years to stop the destruction of your glands.
We've covered the airway, the metabolism, the immune system, but the investigation gets even darker when we look at the brain. Section 4, the neurological red flag. And this brilliantly illustrates how the simple act of our autonomic nervous system failing to produce saliva is directly connected to some of the most severe neurological diseases known to medicine. The tension here is just palpable because this dry mouth could literally be the very first whisper of brain degeneration. Your salivary glands don't just act on their own. They're hardwired to the parasympathetic branch of your autonomic nervous system. When the brain begins to suffer from Parkinson's disease or Lewy body dementia, that autonomic system begins to fail 4 to 6 years before you ever see a hand tremor or a classical motor symptom. A persistent dry mouth, often paired with a loss of smell, is the neurological red flag. Catching this early gives patients a massive multi-year head start on neuroprotective therapy to defend their brain before the severe damage is ever done.
But out of everything we've uncovered today, there is one mastermind that is the most common cause of systemic dry mouth. Section 5, the chemical medicine trap.
This trap isn't a disease. It's sitting quietly in your own medicine cabinet or right on your nightstand at this exact second. We're walking into a massive chemical medicine trap engineered by the very pills meant to keep us healthy. The numbers here are staggering. Over 500 commonly prescribed medications list dry mouth as a side effect. We're talking antihistamines hiding in over-the-counter sleep aids, blood pressure pills, antidepressants, and bladder medications. For a mature adult taking an average of 5 or more prescriptions daily, these don't just add up, they multiply. They combine to systematically destroy your saliva production, stripping away your bioshield entirely by chemical force.
And this isn't just about losing moisture in your mouth. This is a severe chemical suffocation happening deep inside your brain. It's called anticholinergic Bolden. These medications are actively blocking acetylcholine, which is a absolutely critical neurotransmitter. When you stack these drugs together, the dry mouth is just the visible surface signal. Underneath, this massive chemical burden is accelerating cognitive decline and significantly elevating your risk of dementia. Your dry mouth is literally your brain begging for air.
So the crucial point is that you cannot let this systemic shutdown continue for one more night. Here is your high-stakes bodily preservation action plan. Step 1. Immediately stop using over-the-counter sleep aids with different dihydramine, pivot to a microdose of melatonin instead. Step 2. Aggressively front-load your hydration with electrolytes between noon and 4 p.m. Step 3. Run a humidifier at 40 to 50% and apply a nasal strip tonight to force nasal breathing. Step 4. Take your entire pill bottle collection to your doctor and demand a full medication reconciliation.
I want to read this because it's the ultimate empowering clinical revelation of our entire investigation. Aging does not take away your body's ability to recover, it simply reminds you to care for it the right way. Your body isn't broken just because you're over 60. The medical information you were given was just vastly incomplete. Your dry mouth was never a curse of aging. It was a brilliantly designed alarm system doing exactly what it was supposed to do.
And now it's time for you to become the lead investigator of your own physiology. Which of these 7 hidden culprits, the sleep apnea, the afternoon dehydration deficit, the missing vitamins, the blood sugar alarm, the autoimmune sabotage, the brain degeneration, or the chemical medicine trap, is silently draining your body's bioshield right now? We really challenge you to investigate, confront your doctor with these facts, and leave a comment below with what you discover. Do not let your body's warning go unanswered for another single night.